So the main problems that tonsils can cause children is they can get recurrently infected. That's a very common problem. When they get infection, there's pain, fever, sore throat, difficulty swallowing, and the child ends up missing school, which can be really disruptive. The second problem that can happen is the tonsils can grow a lot along with the adenoids at the back of the nose, and that can end up with the child getting blocked breathing when they're asleep. The back of the throat's all made of muscles, so normally the muscles are actually held open when the child's awake. But when the child falls asleep, the muscles go floppy, and then the tonsils and the adenoids can start to fall in. So, for example, a child who's starting to snore can then block completely. So a child would be snoring, just going like this, and then actually they would get completely blocked. But then the body would effectively wake up the child, so and then the child will try and fall asleep again. And we can describe this a bit better by just looking at a photo of the area. This is the area that we're talking about. This is a photo of the back of the throat, and what we can see here is a tonsil on one side, the tonsil on the other side. The adenoids are actually just the same, but they're another gland behind, on the back wall, behind the dangly bit called the uvula, and it's those three that together can cause the problem that we've been talking about. The problem is that they can fall in and block the breathing, and then the child just doesn't get any proper sleep. And what they actually miss out on is the really good stuff, the really deep sleep, when they would be most floppy, that when everything actually falls in the most, and the bit they most need. In terms of how to treat problems with the tonsils, they can be removed. Ectomy means out, and tonsils is tonsils. There's tonsillectomy, plus or minus adenoidectomy surgery at the same time if the adenoids are also found to be big at the time of surgery. In terms of techniques, there's two techniques. There's a traditional tonsillectomy. This is when the whole tonsil is removed, and that is done by going between the muscle and the tonsil. That technique is very good in that 100% of the tonsil's removed, so there's no chance of any more tonsil tissue getting infected. But it's actually a very painful operation in that the nerve fibres to the tonsil run in the muscle, and by doing this operation the muscle is disturbed to some extent. The alternative technique, which we've been doing for about 3 years in the United Kingdom and has taken over in many ways, is to shave back the tonsil so that you end up removing the tonsil, but you just leave a tiny little bit against the muscle, about 1 or 2%, and by doing that you don't get the pain from the nerve fibres as they're left undisturbed. But in each case we just have to assess each child very carefully. There are risks as well as benefits with any surgery, and so we just have to make sure the child absolutely needs the operation, perform it extremely carefully, and make sure it's just the right thing for that child. Whichever technique is done, once the area is healed, the child can't help but have better breathing in terms of having more room for breathing. Thank you for listening and for watching this video. No matter what the ear, nose or throat problem a child has when they come to clinic, they need a full detailed history to be taken, they need a proper examination, and then where appropriate they need investigations to be carried out. And it's at that stage a balanced decision can be made as to whether the way forward is observation or medication, or possibly surgery if that's felt to be best for that individual child. Thank you very much.